Hi everyone, my name is Valeria Calderon and I'm going to be talking about refining antithrombotic therapy for atrial fibrillation and acute coronary syndromes or PCI. Definitions. Thrombosis is the formation of a blood clot known as a thrombus within a blood vessel. It prevents blood from flowing normally through the circulatory system. This can lead to very serious conditions and even be a cause of death. The antithrombotic therapy has been used with atrial fibrillation or acute coronary syndrome undergoing PCI, which means percutaneous coronary intervention. Atrial fibrillation.
Your heart is a muscle that pumps blood around your body. It's made up of 4 chambers, 2 at the top called the atria, and 2 at the bottom called the ventricles. Your sinus node sends out electrical impulses. Atrial fibrillation, or AF for short, is when other areas of the atria send out electrical impulses too. These irregular impulses cause the atria to twitch. When this happens, blood isn't pumped out effectively, which could cause a blood clot to form. If this clot travels to your brain, it can lead to a stroke. When your heart isn't pumping blood properly, it can lead to symptoms such as tiredness, dizziness, or feeling faint, shortness of breath, or palpitations. How AF affects you will determine the treatment you need. Some people with AF, like Harry, only have mild symptoms or may not experience any symptoms at all. Harry noticed something might not be right when he felt his pulse was irregular and sometimes fast. Harry was at higher risk of AF because of his age and high blood pressure. Those with a heart valve problem are also at a high risk. It's important that Harry avoids further strain on his heart by getting treatment for his AF to reduce his risk of stroke or heart failure. The best course of treatment for Harry was anticoagulant medicine called warfarin to reduce his risk of having a stroke, followed by a cardioversion to try and restore his normal heart rhythm. However, some people may need other treatment, such as ablation or other suitable medication. Thanks to his treatment, Harry's AF is manageable and he can return to work and exercise when he feels ready. For more information,
Acute coronary syndrome.
Acute coronary syndrome, or ACS, is the leading cause of death globally. The spectrum of ACS ranges from unstable angina to non-ST segment elevation myocardial infarction and ST segment elevation myocardial infarction. Ultimately, ACS is the result of an obstruction of the coronary arteries induced by an atherosclerotic plaque. ACS events are triggered by the plaque rupturing. This exposes subendothelial matrix proteins and other molecules. Platelets are recruited to the site, adhere to the injury, and, together with red blood cells and fibrin, begin to form an arterial platelet-rich clot. This narrows and eventually obstructs the coronary artery. The extent and the location of the blockage and the resulting myocardial damage determine the extent and the severity of the myocardial infarction. Life-threatening arterial clots are formed through 2 pathways: activation of platelets and generation of thrombin by coagulation factors. Targeting both pathways has been shown to be a viable therapeutic approach.
PCI.
Coronary artery disease is narrowing of the coronary arteries secondary to several risk factors, some of which are cigarette smoking, hypertension, hyperlipidemia, and diabetes. Percutaneous coronary intervention, or PCI, is a procedure used to treat and evaluate partially and completely occluded coronary vessels. Atherosclerosis results from endothelial injury, inflammation, and accumulation of lipoprotein, leading to intimal deposition of particles and narrowing of the coronary artery. The stenotic vessel makes it difficult for red blood cells to pass through. Therefore, the risk of ischemia and infarction is increased. During a percutaneous coronary intervention, an incision is made to isolate the femoral artery. A catheter is inserted into the artery and guided up the aorta to the heart. Live angiography is used to guide the catheter to the obstructed coronary artery. Radiopaque dye is injected into the artery. Imaging determines the location of the stenosis and the diameter of the vessel. Once the vessel is isolated and the obstruction located, a guide wire is threaded through the catheter to the location. The catheter is removed, leaving the guide wire. A balloon catheter is pushed over the guide wire and centered over the blockage. The balloon is inflated to open the narrowed vessel. The balloon is inflated and deflated multiple times to gradually widen the occluded vessel. To ensure that the artery remains unobstructed, a second balloon catheter with a stent is threaded to the location. The balloon is inflated, expanding the stent. For some patients, drug-eluting stents are used to decrease the chances of in-stent stenosis. Drug-eluting stents are coated with a material that will retard new intimal hyperplasia. Blood flow through the coronary artery is restored.
Applications in medicine. Approximately 1 in 5 persons with atrial fibrillation will undergo percutaneous coronary intervention, or PCI, or have an acute coronary syndrome. Several approaches of the antithrombotic therapy in these cases have been scrutinized because they could increase the risk of serious bleeding. This led to the Augustus trial. The Augustus trial is a 2x2 factorial randomized comparison of apixaban with a vitamin K antagonist and of aspirin with placebo that involved 4,614 patients. The trial evaluated the effects of these interventions on bleeding events in patients with atrial fibrillation who had an acute coronary syndrome or underwent PCI or both. This trial led to the conclusion that a direct oral anticoagulant should now routinely be recommended for patients with atrial fibrillation who have an acute coronary syndrome or undergo PCI.
I think Augustus trial is extremely important. I think that it will really educate us and teach us how to take care of patients who have atrial fibrillation, who are also undergoing either a percutaneous coronary intervention or have an acute coronary syndrome. And for the first time, we have a randomized trial that is both comparing different types of anticoagulants as well as antiplatelet therapy versus no antiplatelet therapy.
I think with the addition of Augustus, that's now the 4th trial, so that I think we've established a new standard of care that we're really getting rid of triple therapy and going with a full dose novel anticoagulant and a P2Y12 inhibitor as the optimal approach for patients who've had PCI and have atrial fibrillation.
The trial tells us that apixaban appears to be safer than warfarin or Coumadin, and you do not lose anything in terms of efficacy. And if anything, there appears to be a significant reduction in death or hospitalizations as well. In terms of aspirin, as expected, aspirin versus placebo is associated with more bleeding, but there was no benefit either. So I think it's really important to put this together, right? For the first time, we have a trial that will really help us take care of these patients. We know that apixaban is safer, and it's probably a little bit more efficacious depending upon which outcomes you're looking at. And aspirin really does not provide any potential benefit. So I think this will really help the practitioner figure out how best to treat their patients.
This study is unique in having a formal 2x2, so it teases out the benefit of the novel agent and of aspirin, and each contribute in slightly different ways. but then reaffirmed that really dropping aspirin gets rid of lots of bleeding, and the novel anticoagulant reduces dramatically the hemorrhagic stroke risk, and so both of those together make this really helpful. And then the thrombotic events were very similar despite dropping aspirin, so this really is a win all around. And when putting that together with the 3 prior trials, then we have now the 4th time the same answer of getting rid of aspirin as the right answer for these patients. It's a little nerve-wracking for interventionalists to take away something we've used our entire careers, but now we have a lot of evidence supporting it, so we can look to that and a very robust, large trial here to say this is the right thing after all.
I think guidelines are important. I think guidelines are important when taking care of lots of patients. As a practitioner, I think that you are able, or one should be able, to synthesize their data as soon as they sort of understand what new data shows. I think trials such as this one, I think can be utilized already, right? We are taking care of plenty of patients who have AFib, who also require either single or dual antiplatelet therapy. And I think this trial will go down as really helping us take care of patients and to sort of figure out differences between clotting and bleeding.
Pros and cons. Pros. There was a lower incidence of bleeding events when a direct oral anticoagulant was used in combination with clopidogrel, with an omission of aspirin altogether, which is a dual pathway regimen, than when a warfarin-based triple therapy regimen was used. Reduction in death and hospitalization with the use of apixaban instead of warfarin. Cons. The use of aspirin led to a high risk of bleeding, and clopidogrel was the P2Y12 inhibitor that was used most commonly in the dual pathway regimen, and there's uncertainty regarding its response, variability, and efficacy, particularly without aspirin.
Triple antithrombotic therapy is the standard of care for patients with atrial fibrillation undergoing percutaneous coronary intervention, or PCI, with stenting. Oral anticoagulation and dual antiplatelet therapy with a P2Y12 inhibitor plus aspirin are used to prevent thromboembolic events, including stroke, systemic emboli, and stent thromboses, but they are associated with a high risk of major bleeding. A potential therapeutic strategy to reduce thromboembolic events and bleeding risk is dual therapy, with the oral direct thrombin inhibitor dabigatran and a P2Y12 inhibitor without aspirin. In the multicenter randomized redual PCI trial, 2,725 patients with non-valvular atrial fibrillation who had undergone PCI with stent implantation within the previous 120 hours were randomized to receive either triple therapy with warfarin, a P2Y12 inhibitor, either clopidogrel or ticagrelor, and aspirin for 1 to 3 months, or dual therapy with dabigatran, 110 or 150 milligrams twice daily, and a P2Y12 inhibitor. The primary endpoint was time to first major or clinically relevant non-major bleeding within 14 months. The rate of major or clinically relevant non-major bleeding was 15.4% in patients receiving 110 milligram dabigatran dual therapy, as compared with 26.9% in patients receiving warfarin triple therapy. Similarly, the rate of major or clinically relevant non-major bleeding was significantly lower in patients receiving 150 milligram dabigatran dual therapy than in those receiving warfarin triple therapy. In the secondary endpoints, there was no significant difference in the rate of thromboembolic events or death between patients receiving 110 or 150 milligram dabigatran dual therapy and those receiving warfarin triple therapy. The authors conclude that in patients with atrial fibrillation after PCI, dual therapy dabigatran and a P2Y12 inhibitor significantly reduced the risk of bleeding as compared with warfarin triple therapy, with no increase in thrombotic complications. Full trial results are available at nejm.org.
Issue applied in Ecuador. The use of different anticoagulants should be promoted in Ecuador as well as the control of the INR. Warfarin is the most used anticoagulant for this kind of treatments. And the treatment should be based on the risks present on the patient, like cardioembolic stroke, coronary ischemic events, and bleeding. Finally, the conclusion. Not every patient should be treated with the same medications. The Augustus trial led to specific recommendations that will establish a new standard of care for patients with the previous conditions, instead of relying on triple therapy. Now, practitioners can actually figure out the best way to treat patients with atrial fibrillation and acute coronary syndrome undergoing PCI through the correct antithrombotic therapy. Thank you.